welcome to Aleida's Curiosity Closet. I'm Aleida. On today's show, we're going to be looking at sleep apnea, braces, dental hygiene, and some other things. We have Dr. Arnold here with us today as our special guest. Hi, how are you today?
I'm doing well, thank you.
So how many years have you been a dentist?
Just over 38 years now.
And what inspired you to want to get into the dentist business?
Well, I suppose it was my dentist when I was young. I always wanted to, or I was always interested in getting into the medical field of some kind. And I just remember our family doctor was kind of this grouchy old guy, and yet we had a dentist who was just really cool. He was really liked his work, and he would show me what he was doing as I asked questions. And so it just kind of drew me in that direction. And it, one thing led to another. I was always good at math and science, and which you have to be able to do. And as those time to make decisions came, as far as going into medicine or going into dentistry, it was probably the inspiration of our family dentist that drew me in that direction.
And did your family support your decision to get into a dentist? I know I've heard people say my parents want me to do this, but I did that.
Oh, well, it's interesting. I'm one of 6 kids, and I was the third one, and I'm the only one that went to college. And so my family, my father didn't go to college, neither did my mother. My mother was just a housewife raising 6 kids, and my dad was just traveled, and he was a salesman, and so it was it was unusual for me to go to my parents and say I wanted to go to college, and they didn't have the money to send me to college. So, they supported me in that their kid wanted to go to college, and I was going to figure out a way to pay for it, but they couldn't financially support me. But at the same time, they certainly supported me in anything that I did. But it was a kind of different for them because I was the only one of the 6 kids that wanted to go away and go to school.
So that's always great when family's supportive. I know it's helped me a lot, but has anyone ever told you to fail, like, oh, you can't do that, you're not right for it?
Oh, no, I don't think so. I was always a really good student, and it never occurred to me that I wouldn't be able to do it. And again, my parents, they neither of them had gone away to school, or they didn't really understand what it took to do that. So they just kind of never questioned what I did. They just never said, you could do it or you couldn't do it, because they had never done anything like that before. So they didn't really have a basis for questioning whether or not I would be able to do something or not. But I was always successful as a student, and so I don't think it ever occurred to them that I wouldn't be able to do it either. So
speaking of being a successful student, and you said you need math and science, are those what are some good topics I think you should start in high school when you want to be something, but.
Oh yeah, for sure. Dentistry is very technical, but it's also very biologic. I mean, it's a health science, and so in order to get into dental school, when I went to dental school, you had to have a 4-year college degree before you got into dental school. So it really it was necessary to have something in the biological sciences. So just to be successful in that really takes an aptitude in science and math, I think. And when I was in high school, I took a lot of science and math, and I ended up actually taking a couple courses at the junior college because they didn't offer the next step in high school. So I was taking my last science and math at the junior college. This was down in the Walnut Creek area. So when I went to college, I decided I wanted to go to medical or dental school, and not knowing what I had to take to do that, I asked the guy when I got there, what do I have to take? And they said that I would need to take a biological science. And so I went to school in Santa Barbara, so sitting right on the Pacific Ocean, so I asked if they had a degree in marine biology, which they did. So that's what I did. I got a degree in marine biology. But it's a lot of math and science. I mean, you got to know, you can't ignore the fact that you got to be able to do that sort of stuff.
Did you have to go to college for a very long time? I hear it's many years for a doctor.
Oh, yeah, it's 4 years of college and then 4 more years of dental school, which would be like, the difference between dentistry and medicine is when you finish your 4 years of dental school, you can go out and practice dentistry. When you finish your 4 years of medical school, then you go into your hospital residencies and internships and so on. And so even though those things are available in dentistry, you can, after 4 years, go out, get your license and practice dentistry, which is what I did.
I know with contractors, you have to like renew your licenses and stuff. When you're a dentist, do you have to get extra training and certification like as you continue on?
Yes, yes. Okay. It's we have to take 50 hours of continuing education every 2 years. In fact, mine's coming up in September, but I'm always far beyond 50 units. I usually take 200 or 300. I go to school a lot because it's a lot to learn and I want to stay on top of it. So I go to a lot of courses. In fact, I'm going to a course this weekend on TMJ and head and neck pain. So I'll be in San Diego for a couple days.
Do you teach any young students who are interested in being dentists?
Not really, not young students. I teach at UCLA. I have a faculty position there. I go down a couple times a year and lecture to they're the first and second year residents in orthodontics and pediatrics, and I enjoy teaching, and that really gives me an opportunity to do so. But these guys are already doctors, and it's an advanced program. But I do enjoy the teaching, and I do lecturing on the things we're going to be talking about. But the young kids, I don't know. I would like to. I mean, if given an opportunity, like to go to the high school and have some kind of gathering of people who are interested in doing what I do, I'd be happy to go down and do it. I don't know whether there'd be much interest, but I would certainly be willing to do that.
I know there'd probably be quite a few students who'd be interested. I know a few who want to be dentists. So you don't really have many teens, like there's not a teen who comes to the office and goes, "Ooh, what are you doing?" Or,
oh, yeah, yes, I do. Although I don't know, not as many as you might think. I don't know whether it's just, the intimidation of being a patient in a dentist office, but I don't have a lot of people questioning me about it. More so kind of like what you're asking, how long does it take and what sort of things do you have to be able to do, things like math and science and stuff like that. But not too many people ask me, not as many as I would hope anyway.
What are some cool tricks you've learned, like just from being on the job? Do you teach any dentists? Do you see some of like the cool different things you can learn?
Oh yeah, no, there's tricks to a lot of different things because I've done it for so long. There's like a way they taught you to do a denture, and there was this step, and then this step, and this step, and this step, and this step. And as I've done it over and over again and thought about it, all of a sudden I figured a way to combine steps and do some things like that. And then you get together with dentists, like at the meeting I'm going to this weekend, where you'll be taking a break and you're standing around just talking to people. And usually I know some people at some of these meetings. And so somebody will say something about, I tried this material on this particular procedure, and it really worked pretty cool, but then I tweaked this and I combined it with that, and it's like, oh, okay, well, I did something real similar, but I did it this way. And so, yeah, it's really cool. Sometimes you learn, like I'm going to this class, and there'll be lectures, and I'm kind of participating in this one level of it, but a lot of times you learn as much when you're not at the lecture, and you're just hanging out, and you're talking between lectures, or you're sitting at lunch. A lot of times you share a lot of information and a lot of the things you're talking about, just little tricks on how to do things and how to pick up new ideas And it's really interesting because people have figured stuff out, a little differently than the way we were taught. And so it's fun to get together and talk about stuff like that. But it usually occurs in very kind of candid, very kind of loose, structured things like a lunch or just sitting around talking with somebody.
Is there anything that you see, like you talk to a dentist and you wish maybe they focused more on a certain type of dentistry that they don't, like they don't tell all the patients what they should know?
Don't get me started. Probably the biggest thing that I think is neglected in paying attention to especially young patients is their breathing. I think that dentistry is so obsessed with teeth, just teeth, that, how are you going to fix this? And oh, you have decay, so you've got to do this. And so it's very tooth focused when, the tooth is just a part of what's going on in the mouth and the jaws. Questions should be asked patients, do you have headaches? Because that's can very easily have something to do with the jaws and the bite. Breathing is an extremely important, how a person breathes is extremely important on how a person grows, how their face grows, and the position of their teeth, and orthodontics and things. So I think that dentists look at teeth and don't see all the rest of it going on. And I think that dentists have a unique ability, especially like with us, with you, when you were young. You were seeing your family doctors, but they weren't looking at your airway and your breathing and how that could have been affecting your growth and the change in your face and how important that sort of thing is. The difference of breathing through the mouth and breathing through the nose are extremely important as far as growth is concerned. And here dentists I think have an opportunity to screen people for this sort of thing. And I don't think it's done very often in a dental environment. We need to talk with patients about their overall health because there's a relationship now that we found between gum disease and heart disease and other systemic disorders, diabetes and things like that, again, so often we get so focused on just fixing teeth that the rest of things that are very available for a dentist to ask questions and to evaluate, but I think oftentimes that gets kind of overlooked. And I think that we need to look more at the whole person and in children, the growth and development of that person as it relates to their breathing and their chewing and their swallowing and their speech. I mean, these are all things that are very, very involved in what we do, but I don't think too many dentists pay as much attention to it as they should. I think that's my opinion anyway.
So sleep apnea fits very well into that. And I've heard different things about sleep apnea. I've heard it all, oh, that just means you snore, or that just means this or that. What exactly is sleep apnea?
Okay, sleep apnea, an apnea is 10 or more seconds where you don't breathe. That's what an apnea is. Now, sleep apnea is obviously a time when you're sleeping when you don't breathe for 10 or more seconds. And then there's a thing called a hypopnea, which is reduction of airflow by 50% or more for 10 or more seconds. So you have, and it's kind of interesting because I was first made available, or first really made aware of sleep apnea back in the middle 80s. And I had never heard of it before. And here I'm a dentist in the health field, and I had never heard of sleep apnea. But I don't think anybody had back then. I mean, there were some physicians, but what it is, and it's mostly, most attention is paid to it in adults. But what it is over and over and over during the night, your airway gets closed, and you stop breathing, and then you gasp and start breathing again. So it's kind of thing. Now, snoring is more kind of a partial closure where it doesn't completely close, but it reduces the amount of air that's flowing in. So snoring is a symptom of sleep apnea. It doesn't mean you have it, but it's a symptom. Means you probably have some amount of sleep apnea. But sleep apnea can be a very dangerous condition because you don't breathe. And now if you say you do 20 of those an hour or 40 of those an hour and you sleep for 8 hours, I mean, that's a long time that you're not breathing. And so that's why all of a sudden this has become a really visible sort of thing. But it started more with adults than children. And what I think we're beginning to realize now is that sleep apnea is just as apparent and as dangerous in small children as it is in the adult population. But sleep apnea is basically, it starts as kind of a snoring thing, but then it just becomes so that the whole throat shuts down. It's caused by the back of the throat, the tongue, and the soft palate. So a little uvula, little thing that hangs down the back of your throat, the back of your tongue goes up against that and then to the back of the throat and seals it off. Now, if you think about if you're laying on your back, your tongue's gravity is gonna pull it back there. But we're not, the tongue is a muscle. Muscles usually have, a certain tone to them, so we're not supposed to have that happen. But in adults, it's mostly caused because they're older, they're overweight, they may have a cocktail or two before they go to bed or after dinner. They might take medications, but for whatever reason, the muscles collapse more as we get older. And so it becomes more of a thing with older adults as that sort of thing happens. With children, probably the greatest cause is adenoids and tonsils, which just block up the whole area back there.
Now, how do you tell an adult or a child if they're not sleeping and they're at a dentist checkup? Is there anything that really makes you think, oh, we should focus on this when you look at an x-ray or something?
Well, with the x-rays that I take with kids for orthodontics, you can actually see the airway. And so there's a way that you can evaluate the airway from an x-ray. It's not perfect, but it kind of gets you in the ballpark. With adults, it's mostly, well, again, back to children, you can oftentimes tell the way their lips are apart or the lips are together, how they sit, how they hold their head. There's a lot of indications that there's an airway problem. Because if an airway is blocked, a person's going to bring their head forward, they're going to tip their chin up, and they're going to open their mouth and bring their tongue forward. And in a child, you see that very clearly, especially with large tonsils. And so that's pretty much a giveaway. I can tell a child probably has a sleep problem without ever looking in their mouth or even asking a question because of just the way they look. In adults, it's a little more kind of random. And mostly it's that I ask certain questions. I ask questions if you have morning headaches or do you snore? There's certain bites, there's certain jaw positions, there's certain just kind of indications with grinding of the teeth and so on that you can see that are also indicators. So I've done it for a long time, so there's just things that I pick up and I know when to ask the certain questions. And so I can usually figure it out, whether a person has it or not.
Are there different levels of sleep apnea?
Yes, yes. And it's based on how many of them you have. So normal is that you don't have any, or you have as little as 5 an hour. So that's still considered that you're okay. Anything over 5 to 20 is an hour. It's called the respiratory disturbance index. And it has to do mostly with how many an hour, but there's also some indicators with brain activity and so on. But if you have 5 to 20 of them an hour, that's considered mild. And then 20 to 40 is considered moderate, and then over 40 is considered severe. And sleep apnea can be life-threatening. I mean, when it gets very severe, it can actually put a person in a position that they can suffocate. They stop breathing long enough that they can actually die. And with very huge obese people, they actually have to do a tracheotomy, which is they put a hole here into the airway because it's too blocked up that they just can't breathe. And that's a life-saving thing with somebody with severe sleep apnea.
And how is are they all differently treated?
Yes and no. The medical community, in fact, we were just having this discussion a little bit ago. The medical community, the gold standard of treatment, the basic treatment is a thing called a CPAP, which is this face mask that you wear that pumps air. And if you blow enough air down the throat can't close. And so that's their main solution to sleep apnea is this thing, this CPAP, this mask and pump. Me as a dentist, we can make a mouth guard, like a mouthpiece that brings the jaw forward. And when you bring the jaw forward, the tongue comes with it. So when the tongue comes with it, you're opening up the airway. That's the first thing you learn in CPR, is bring the jaw forward. You know, tip the head back, bring the jaw forward. And it's the same principle. It's a mouthpiece that brings the jaw forward, and in doing that, you can open up the airway. Now, if it's mild to moderate, that's okay. That'll work pretty well. And in my hands, that's fairly predictable. That'll work pretty well. When it's severe, you're looking more at the CPAP, the pump, or even surgery. And surgery, they cut off part of the soft palate and the back of the tongue. They actually will cut some to thin it. Yeah.
That sounds
crazy,
really
huh?
painful.
It's crazy, yeah. It is crazy. And
Wow.
but you know, sleep apnea is just this thing you read about, but you know, and snoring is a part of it. But it's, you know, it's in adults and it's in children, and it can be really severe, or it can just be mild enough that it doesn't need to be treated, but the snoring can be, you know, wake up the whole family. And so oftentimes it's not so much the sleep apnea, but the snoring that people will want to make one of the mouthpieces for, because the mouthpieces will pretty much take care of the snoring, which is pretty cool. The whole family appreciates that. You know, if you've got anybody in the house that snores, you know, it's like, God, it keeps everybody awake. So, but anyway, but that's kind of the basis of sleep apnea and the treatments. And there are different levels, and the treatments mostly, dentists treat it their way and physicians kind of treat it their way, so.
I've always been really curious, is it like a genetic thing? Is it like seen in a certain age group more? I mean,
it probably the biggest offender now is weight. Just as we get larger, you know, and as we age, we have a tendency to put on a little more weight. It has to do with the girth, basically, of the throat. And when you put on weight everywhere. I mean, the back of your throat, the sides of the tongue. I mean, everything gets bigger when you gain weight. It's not just in your belly or wherever. So, obesity probably is the greatest offender. But I've had thin people have sleep apnea, and so there's some central nervous system things that are involved. So your brain, but a lot of times it can also be medication. You know, people take allergy medications is a good one. I mean, you know, they kind of make you sleepy. You know, certain allergy medications. Well, it does the same thing to muscles. Muscles get sleepy, for lack of a better description. So they kind of get more flaccid, and so they kind of collapse. So it's probably more evident in older adults, or older, larger adults. But with kids, it's kind of interesting because in the very young child with large tonsils and adenoids, they're not obese at all because they're not very healthy. Because they're not breathing properly, they're not growing properly. When they're not growing properly, they actually are kind of frail. But it's when they get to be 9, 10, 11, as they start reaching puberty, then the kids with sleep apnea are more obese. You see that change occur. But the very young child with sleep apnea is usually fairly frail. They're not very healthy because they can't breathe. You know, they just can't breathe very well.
So, I know this may sound silly, but I've always been curious, can braces affect sleep apnea?
Usually it affects it in a positive way. There's certain kinds of orthodontics that I kind of object to where teeth are taken out to make space. Now there are reasons for that to occur. I think a lot more of it's done that should be done. But when teeth are removed, it makes your mouth smaller. And when your mouth is smaller, you don't have as much room for your tongue. When you don't have as much room for your tongue, it's going to go back. And that's right where the sleep apnea occurs, right? So, but most of the time, braces improve the area. It makes it expands, it makes more room for the tongue, but also as we kind of help with growth, the jaw grows forward, and the more the jaw grows forward and we expand, the better the risk of sleep apnea becomes. So we, by making things bigger, bringing the jaw forward, we actually improve the sleep apnea. And in fact, sometimes orthodontics is a good idea to have to try and get rid of the sleep apnea, besides taking out the tonsils and adenoids, which you know. Yeah.
So if you're concerned that you or your kid or whatever has sleep apnea, what would you say to do?
I would first be aware whether your child snored or not. I mean, that's a huge thing. I just brought this article along, and this is June of this year, so this is last month. This is a brand new journal, and they've got an article in it about childhood sleep apnea, which is wonderful to see because I did my first lecture on children and airway like 30 years ago, and so it's good to see that they're finally coming around, and it's becoming more evident, and dentists are learning more about it. But if I were a parent, the thing that I would look out for would be snoring. I mean, if a young child, I mean, this is an infant even, if they're having trouble breathing at all or are loud breathers, you know, like just making noise, not necessarily snoring, but just a deep breather, you know, when they sleep, but snoring for sure. If a kid snores, that's not good. That means that their airway is being obstructed and they're not getting the air that they need to grow. And they're relating poor performance in school, just unhealthiness, attention deficit, all these different childhood problems, they're relating to sleep problems now. I mean, they're saying if somebody has attention deficit disorder, the first thing they should do is have a sleep study, because that it may have something to do with their sleep patterns, and it could be sleep apnea.
Wow.
So, yeah, I think as a parent, you know, it's kind of interesting, Aleida, when I'll say something to a family saying, does anybody in your family snore?
So, like, the thing with children is a very huge deal, and we're about out of time. And
oh, okay.
No,
I'm
I'll
sorry.
definitely have you on again.
Yeah.
Thank you so much for joining us.
Yeah, no, I'm happy to talk about this stuff.
I'm sure lots of children will be very safe with their parents knowing all this. And
yeah.
Thank you so much for joining us. It was great to have you guys watching, and I hope to see you next time. So don't forget to like Aleida's Curiosity Closet on Facebook. Bye.